the test is for emergency medication administration exam for a glucagon, EpiPen, and Diastat. Okay, so as I mentioned, I'm the district health coordinator. I oversee health services and the other nurses that are in the individual schools. So they are definitely your go-to people. They know your school population better than I do, but please know that I'm always here if you have a question. I'm at central office. I do have 3 of the school nurses that are with me here today, so if you have a question or you have a difficult time following along, we're going to go through the book and you're going to take the test at the same time. They will gladly come to you and answer any questions you might have, or I'll answer the question, so feel free to stop me at any time. Raise your hand and they will come around to you, okay? So today's class is on emergency medication administration, and the reason why you're taking this class is because as bus drivers and monitors, you may have students on your bus that have medication for life-threatening illnesses. Life-threatening illnesses are seizure disorders, allergic reactions, also known as anaphylaxis. They're very severe. Diabetic students that might have extremely low blood sugar, they need an emergency medication if they become unconscious. Those are the medications students may self-carry. Along with those 3, they are also allowed to self-carry inhalers. The training module that we're about to go over, inhalers are considered routine medications, so we're not going to go through the manual so much on inhalers. But as you probably are aware of, inhalers are life-saving medications. People do die from asthma episodes, and it is important that students are able to carry their inhalers with them at all times. So we're going to add that to the emergency medication training today. So those are the 4 medications that students may have during their bus ride to school or home. And we're going to go into those in detail. Your training manuals that you have, the booklets, they are highlighted. Some of the material in them is just incidental. We tried to highlight it so that it drew your attention to the more important information. The green highlighted areas as we go through the manual, those areas contain information that is pertinent to the test questions. Now keep in mind, I have a couple tests that I run through this manual, so that doesn't mean that green information pertains to the test that you might have in front of you today. But I assure you that if you follow along with me, and I will even stop and tell you what test question you should be up to, and we're going to turn the pages together, you'll be able to very easily pass this exam. The yellow information that's highlighted in the booklet is just what I feel is important information. I have rearranged the test questions chronologically to follow along in the book, so you're not going to have to be jumping around. My only request is that you do not write in these manuals. I've been using them for many years and I hope to continue to do so, but I don't want you to write in them. If you need to make notes on your test packet that's stapled, that's fine, not a problem there. So we are going to start with the booklet, and we're just going to go over some of the general information here. On page 5. And it's just the acknowledgments. I want you to know that this is a collaborative effort. The Kentucky Department of Health, the Kentucky Board of Nursing, the Kentucky Department of Education, they all came together in 2011 and developed this manual so that we had uniform training throughout the state for people that had needed medication training to be able to support our students. And the reason for that is it reduced barriers. That meant that students with medical conditions that might otherwise, parents might not feel comfortable in them coming to school could now come to school, because we can guarantee throughout the school day, and the school day is a very vague term, so we call the ride to school and the ride to home the school day, those students have someone trained that is able to administer their emergency medication if the need would arise. So that's why you're here today. So then we're going to move on to page 8 and 9. That yellow information on page 8 tells you that there is actually a state law that says we have to make sure that someone's trained at all times. And that training is valid only for the current school year. So, as I mentioned previously, July 1st, each summer starts the new school year. So even if someone took training mid-June, they have to start again on July 1st. And that's why we trained our bus drivers and monitors that drove for the summer school programs on July 1st so that we could stay with the laws and the regulations. On page 9, it tells you that after we take this test, you're going to have to do a skill competency evaluation. And that's why we're going to break up into different groups. We're taking the test as a whole, and then we have some classrooms we're going to break you up into, and you're going to actually work with the emergency medications and do a return demonstration. And until you pass that aspect, you're not considered trained. So please stay with us. You need to achieve an 85% on the exam, so that means you can miss up to 5. Again, I feel confident the way that we're going to do this is that you're going to do well. Okay. All right, so on page 11, we're going to start Module 1. It talks about the legal aspects. Again, yellow information is important. Green might be a test information. And again, do not write in these manuals. So, school personnel who do accept the delegation of medication administration and successfully complete this course are protected from liability under KRS 156.502. That regulation contains the Paul P. Covedale Teacher Liability Protection Act. And that means if we can prove you've been properly trained, you're protected from liability. So again, that's why we're very specific on how we're doing this. You're going to sign a document when you go into the return demo classrooms, and we're going to say that you're competent to do this. Only physicians, dentists, advanced registered nurse practitioners, and registered nurses can be the supervisors who delegate this. So that's why I'm here today. I'm one of the RNs in the district, and the other ladies that are here with me today are also RNs. We have RNs and LPNs as our school nurses. They're all very competent, professional people, and they know your students very well. But for the purposes of the training, it has to be an RN because training and delegation is in their scope of practice. So that's why there's only certain people that do the training in the district. Okay, so just so you can follow along, you should have been able to answer questions 1 and 2 with that information I just gave you. Okay? Everybody sort of getting the feel for things here? If you listen to me, I think you'll be able just to answer the questions very easily. Okay. Pages 12 and 13. So as I just mentioned, only certain people can be the supervisor who delegates. What you need to know is that person doesn't have to be present in the building at all times. They just need to be available by phone. So that's why if you have a question, you can radio the school nurse, have the transportation department radio the school nurse, stop in and talk to her before your route in the afternoon. And like I mentioned, always call me. That supervising person does not have to be in the building at all times. Again, on page 13, it talks about how this is an annual training, and it's only good for this school year. Page 14 and 15. We need to talk a little bit about confidentiality and privacy. So students on your bus that might have medication means that they have a medical condition. That information is to be kept private. In the school system, we work under a federal regulation called FERPA. Some of you might be more familiar with the federal regulation called HIPAA. That's more in the medical setting. School records are protected under FERPA. So even though it might be a medical record, an immunization record, a physical, that's what it's protected under is FERPA. And we only share medical information on a need-to-know basis. So, as bus drivers, driving students that have seizure disorders, I feel you need to know that information. But that information is for you and you only. That's not to share with a neighbor or a friend that might ask about Johnny Smith who rides your bus. It's confidential information, and it's to be kept private. I want to take a minute to regress here and not follow with the book, but take a minute to tell you how you're going to know about that confidential medical information. For those of you that are return drivers and monitors, you're very familiar with the red folders that are in the buses. For those of you new to the district, these red folders designate that there's information contained within regarding students with medical needs on your bus. So in those red folders, there are procedures to follow for emergency bus medication. And there's also step-by-step guidelines for quick reference and review on how to administer the 3 emergency medications that we're going to go over. Those are all contained in the middle section of your red folder. In the side pockets, you might see information that looks like this. These are what we call bus forms. So what happens at the school level is that if a school nurse gets information regarding a student's medical condition that they could possibly need emergency medication, we generate a bus form for these students. So what it does, it gives the student's name. We put the bus AM and PM on it. It gives the emergency action plan for that student's medical condition. So these are medical condition specific. We have the emergency action plan. We talk about what the emergency medication is for that condition. We have the contacting information for the physician and the parents on here. If there's a photograph in Infinite Campus, our student information system, I will put a photograph on this paper so that those of you that are sub-drivers have a quick reference as to who this student is on your bus. But what the most critical piece of this whole paper is this top right corner right here. This top right corner says, yes, the student carries an emergency medication. If there is a check in that box, that is your sign that that student could possibly have that medication on their person when they get on the bus. Now, can I guarantee that? I can't, because that means that the parent is the one that has to make sure the kid brings it to school every day. As school nurses, we're sure that we have the orders for that medication and that the physician has said that that student can self-carry that medication. And some medications they may self-administer, like asthma, the inhalers, or the EpiPen even. People can self-administer that. But this box is your cue that you might be called into action to administer the medication. Underneath that, we also even try to provide you with where the parent has told us that medication will be. So is it going to be in their front pocket of their gym bag or their backpack? Is it going to be in their purse in a little kitty, holder? Some sort of quick reference information. Again, I can't guarantee that's where it's going to be. So you as bus drivers, I charge you with being able to look for that information at least once, if not twice, during the school year. You need to do it confidentially and privately, but ask that student to see where that medication's at. Put eyes on it. so that you can, first of all, see what you're going to be using. Second of all, make sure that the dose is not expired. Again, I don't know what they're going to bring back and forth to school every day. It could be an EpiPen that expired a year ago. Don't put yourself in a situation where you might have to administer emergency medication and you've got an expired medication that might not work. Okay. In the school, the nurses, of course, check for that information, but on the bus and when kids self-carry medication, we can't guarantee that. For students that are able to self-carry and self-administer their inhalers, we do not do bus forms for that. Those students with inhalers are very capable of administering their own inhaler. And if we gave you bus forms for every student that had an inhaler in our school district, I think you would have so many that you would not pay the attention to the detail of the importance of these. Again, inhalers are very important, and they can save lives. And if you see a student use one on the bus, know that they're in some sort of respiratory distress, and you might have to pull over and just make sure they're okay. But most of those students can self-administer, so we do not do bus forms for those. So any questions about the bus forms? Okay. Also, too, the bus forms. A couple years ago, one of the bus drivers said, so, okay, these bus forms, they're really important. What happens if we have a kid that gets a bus pass to go home with their friend? And the bus they normally ride has the bus form that says they have seizures. How am I going to know that that student has seizures if I'm the bus driver of the bus they're driving home with a friend? Valid point. So we did listen, and we came up with a way that the secretaries have a way to look at Infinite Campus. Before they issue any bus forms, they have to look at Infinite Campus to see if there's a bus form, and they will then give that to staple it to their bus pass for them to go home on the other bus, so that that new bus driver for that one day at least has that information. So that might be a reason why it's not in your red folder and you see it come on the bus with the student. It's because they've had a bus pass. And we think it's important you need to know that they have that medical condition. Okay. All right, so back to the book. Everybody answer up to question 5? Okay, page 15. Just a little bit of information so that you know how serious we do take all medications in the school district. Regardless if it's an Advil, a Tylenol, or if it's a medication for ADHD or an emergency medication, we require a medication administration form to be filled out and signed by both the parent and the physician for all medications. So we're sure that we have the proper prescribing information for those students. And as I mentioned, there's 4 medications students can self-carry, and the physicians have to give us permission to do that. The inhalers, the EpiPen, the Diastat, and the glucagon. Those are the 4 they can self-carry, so those are the 4 you might see with students. If you see a student put any other medication in their mouth, it's not supposed to happen. Of those 4, there are 2 medications, as I mentioned, that can be self-administered, the inhaler and the EpiPen. The Diastat, of course, if someone's having a seizure, they can't administer a Diastat. And the glucagon for the diabetic students is only used if they're unconscious, so of course that's when you're going to be called into action. Page 16 and 17. Changes in medication, for your information, require new forms. We don't just take lightly a parent calling up and say, oh, their ADHD medication is now 40 milligrams. We need the orders. And emergency medications we always want to have available, so we keep them unlocked during the school day. And that's why they're available to students to self-carry as well. Field trips and medication administration. Staff members that take groups on field trips, those staff members are the ones that are supposed to be, or that are the responsible ones for medication administration. That's not your job when you have a group of kids on a field trip to be the one medication trained. With that being said, there are a few instances where we have a lot of difficulty trying to get, let's say, gifted and talented kids. We'll pick them up throughout the district, and it might be a couple stops before we get that medication trained person on the bus, their staff chaperone. In those rare instances, with transportation's approval, you might be the medication trained person, and the school nurse will let you know if there's a problem or if there's a student on the bus that has medication. Okay, so you can just look through pages 18 and 19 at some of that highlighted area. We do have students that refuse medication, but that's not called a medication error. Now, that's not an emergency medication. If you feel a student needs an emergency medication, it's your responsibility to make that decision and to give it. Okay. So the next module 2 talks about routine medications, and we're going to skip over that because you're not going to give routine medications on a bus. You're only dealing with emergency medications. So we're going to skip to module 35. I'm sorry, module 3, page 35. So this is where we're going to go into detail with those 3 emergency medications that I discussed. But also, too, as I mentioned previously, inhalers are not considered emergency medications as far as this manual is concerned. As a school nurse, as a mother, you know, I think an inhaler is a life-saving medication. So we're going to go over this just a little bit. You're not going to do the return demonstration in the sessions after this for the inhalers, but I just want to go over it briefly. Optimal that inhalers are carried by students in a box with their name and the prescribing information. Tell them how many puffs to take and then how many minutes apart. These boxes get beat up. They're in and out of pockets all the time, thrown all around. You're going to see this. Chances are you'll never see a box. And you're just going to have to trust that the child knows how to administer it. I mean, if they aren't competent in giving themselves their own inhaler, then the nurse will make the decision to train you separately. But what happens is kids don't properly take inhalers for several reasons. They're in a hurry, or they're just anxious because they're having a hard time breathing, and you can imagine how much anxiety that could cause. And what they'll do is pop off this cap and give themselves 2 quick puffs and think they're done. That's not the way to properly administer an inhaler. Inhalers need to be shaken first, and then depending on the orders of the physician and how they've instructed the child, they'll either put it in their mouth and push down and take that deep breath in, or now some physicians are even telling them to hold it outside their mouth and puff and take that deep breath in. What happens when they put it in their mouth, although the medication is inhaled and goes into their lungs, a great amount of the medication is left in the oral cavity, so that's why they're telling them to puff it outside their mouth. Okay? They take that deep breath, hold it for about 10 seconds, exhale, and then they wait at minimum 1 minute before they do the second puff. If they take this and do 2 quick puffs, it's not a therapeutic dose, and chances are they might need it more sooner than what they should receive it. So make sure they take it properly if you see there's inhalers on the bus. You might also see these devices. They're called aero chambers. Really the best delivery for inhalers. Still shake them up. But the medication goes in the back of the aero chamber. The child puts this in their mouth. They puff down. The medication is held in this chamber, and they put this in their mouth. They take that deep breath in. They're really getting it in their lungs, and they're not getting it in their oral cavity. So these are called aero chambers. If you see a kid pull this out of their backpack, don't be alarmed. Kind of bulky though, so the older the kids get, the less likely it is that you'll see them. Aero chambers. This is another similar device that you'll see younger kids use. Again, you shake it up, you put the inhaler in the back area. The child that uses one of these, of course, it goes over their nose and mouth. They're for younger kids that have a hard time differentiating where they take that breath out of, if they breathe in through their nose or their mouth. So this way it doesn't make any difference. Put it over their nose and the mouth, puff on the back end, the medication stays in the chamber. And again, these are usually younger kids, so we just tell them to take 5 or 6 normal breaths in and out, remove it, wait the 1 minute, and then do the second puff. So a little bit of information about inhalers. Any questions about those? All right, so page 35. Yes?
Recently I was taking care of someone, and there was like a new inhaler that I hadn't seen before, and it was a twist.
Yeah. There's a whole bunch of different inhalers out on the market, actually, and for me to keep up with all of them, it's very difficult. Some of them are discs. You won't see the aero chambers with those newer devices, but there are all different types out there. Yeah. And they're allowed to self-carry them. It's, again, there's a state regulation that tells us students that suffer from asthma and allergies are able to carry their inhalers and their EpiPens, as well as a new state law about, how we have to manage diabetics in our school district, and also a law about seizure medication. Okay, so page 36 and 37. As I mentioned, there's a KRS 158.838 that says unlicensed school personnel may administer the emergency medication, the glucagon, the diastat, and the EpiPens. So the first medication we're going to talk about is the glucagon. And glucagon is a medication that people that have diabetes might carry in the event they have a hypoglycemic event. Hypoglycemic means low blood sugar. First of all, you need to know what someone with diabetes has to deal with. And the problem for their medical condition is their body does not have the ability to produce insulin. So what happens is they'll eat food with carbohydrates and they have no way to break that carbohydrate down, so their blood sugar will be very high. But there's also times that their blood sugar will drop because perhaps they've had too much insulin, or they might have a lot of activity and it causes their blood sugar to drop. Most of the kids that are diabetic, they know what their body's telling them. They know when their blood sugar's starting to drop. And if they have that sensation, all they have to do is prick their finger, test their blood sugar, see what their number is. 70 to 120 is about normal. And they know what to do to try to manage that. If their blood sugar is low, they'll put a couple pieces of candy in their mouth, about 15 grams of carbohydrate, a juice box. Something like that will bring their blood sugar up, and they'll be fine. For your protection and for the protection of our students, at the end of the day, for students that ride buses home, we test their blood sugar about 15 minutes before departure. That ensures us and you that hopefully you won't have to deal with a hypoglycemic event on the bus. So if those kids come to us at the end of the day, they're low, let's say 50, we're like, that's not a good number to be at for a 45-minute bus ride home, right? So we'll give them some carbohydrates in the nurse's office. We'll have them retest their blood sugar in about 10 minutes. Their number goes up, we'll send them back to class and tell them they're good to go home. Sometimes we have to give them 2 loads of carbohydrates, 2 15-gram loads of carbohydrates. That's because their blood sugar, in all likelihood, was really dropping. That first load didn't get in them quick enough. Hopefully that second load will. We'll retest them again before, and make sure their number is good before we put them on the bus. I will say there was a few times as an elementary school nurse, I would give a child 2 loads of carbohydrates and I still wasn't happy where their blood sugar was. I'd make a call home, let the parent know, make sure there's a parent when they get home, and I would walk that student out to the bus, tell the bus driver what's going on, and put them the first seat behind you so you know to keep an eye on them. If you have an emergency folder and it designates you have a student with diabetes on your bus, I recommend that you try to keep some non-perishable candy on your bus, perhaps, or in your pocket. Some Smarties, a nerd, you know, little fun-sized thing of nerds. Something that's carbohydrate, that if that student says they're not feeling well and they don't have the ability to test their blood sugar on the bus, you can always err on the side of caution and give them some carbohydrates to make sure that their numbers stay good until you can get them home. So non-perishable, not a chocolate, because of course that's going to melt in the extreme temperatures. But also too, because chocolate contains fat, and fat delays the absorption of carbohydrates. So you want it to be a simple carbohydrate, sugar. Even a couple packets of sugar would do, actually. So if you could do that to help us out and to protect the students and to protect you from having to give the glucagon, I would appreciate it. So there are, like I said, a hypoglycemia event can happen because they might have had too much insulin. They might have a delay in receiving a snack or a meal, or physical activity. Those are some reasons, but we have put some caution protection in place for the end of the day and for the bus ride home. Glucagon is an injectable medication, so that's why it's only needed if they are unconscious. If they are able to take food or liquid by mouth, that is your first response. Okay, so with that information we just discussed on the glucagon and diabetes, you should have been able to answer questions 6 through 10, and actually 11 and 12. So I'll give you a minute to catch up. Any questions? Okay, page 37. That information in green really is information we've already discussed, is that there are Kentucky regulatory statutes that tell us that we have to have at least one school employee that's met the requirements of medication administration training on duty the entire school day. And we called the bus ride to school and the bus ride home part of the school day. We do try to notify parents at least 1 month in advance before medication expires. Again, medication in the nurse's office, we're aware of what the medication expiration dates are. But those medications that come back and forth to school, we can't tell you what that date is. That's what information you're going to have to find out on your own. If you find that a medication expired, you can contact that school's nurse and they will help you get in touch with the parent and see that we have medication available that has a good date. Okay, up to question 15, right? Page 38 of the manual gives you step-by-step directions on how to administer glucagon. Anytime you administer an emergency medication, an EpiPen, Diastat, or a glucagon, we want you to call 911. Now, in the home setting, that might not be the case, but in the school setting, that is our policy. That's what we're going to do. We want EMS to come to you to transport that student to an emergency facility to get medical attention. Transportation is a little bit unique. I know you guys have, you call Steve and you tell him what's going on. Keep in mind that Steve has a copy of all the bus forms for all the students. So he has that information available quickly too, where we can contact the parents as well. If you have a monitor on your bus, of course you're going to pull over the bus. And if you have a monitor, perhaps they can be the one that is calling the bus transportation or the one calling 911. I can't tell you what the exact circumstance is going to be because there's probably many, many scenarios. But that is important. That's always the first thing you do when you administer emergency medication is you designate someone to call 911. Okay. So when you go into your sessions for the return demonstration, you're going to be working with trainers in these white kits. I don't think the trainers very accurately give you an idea of what the glucagon looks like. So although you're going to do the return demo with this, you're also going to have an opportunity to see what a real glucagon looks like, and they're in the red kits, and there's a couple of these in each classroom for you to look at. The kits have step-by-step directions in the lid for you to have quick reference. Remember, in the red folders, there's also a sheet of a quick reference guide for you to review. The glucagon comes with a glass vial that has powder in it. Powder is so fine, it almost looks like a tablet rolling around in this vial. But like I said, it's very fine. It comes with a syringe, a glass syringe that has 1 cc of saline in it. And you have to be the pharmacist for this medication. It's very unstable in its liquid form. So you have to mix the liquid with the powder to make the medication. So what you're going to do is you're going to take the cap off the vial of powder. You're going to take the cap off the needle. You're going to put the needle into the vial of powder, and you're going to push the whole cc of saline into that vial. And that white powder is like cotton candy. It's going to quickly turn into a clear liquid. You just need to give it a little shake, keep it together as a unit, give it a little swirl, and that'll help mix it up. Now keep in mind, this is a kit, and this kit is dispensed from the pharmacy for all people that have an order for glucagon regardless of their size. So that means for a little 35-pound preschooler, this is what they get. For a 200-pound high school student, this is what they get. So once you mix the medication together, and it's in the liquid form, you need to know what dose to give the person. And you've got two options. The dose is based on the size, and you don't need to know what to give because the dose is going to be on the outside of the container. It's going to have the student's name. It's going to say mix as directed, and give a half or 0.5 milligrams or 1 milligram or 1 cc. So you need to know where that information's at on what dose you're supposed to administer to that student. So once you've given it a little swirl, you're going to make sure that the vial is the side that's upmost. And you're going to take and pull back the plunger on the syringe to get the dose that you need. And again, you're going to find that dose on the outside of this container, right? It's important that you hold it upright like that. There's only going to be 1 cc of fluid in there. If you happen to hold it sideways or you hold it vial side down and you create that vacuum by pulling up the syringe plunger, if you don't have it situated right, you might get a syringe full of air. Air's not going to do anybody any good. So if that happens, if you notice that you've got a lot of air in that syringe, just push all the medication back up into the vial. Be more conscientious of what you're doing. Make sure the needle is in the fluid that's in the vial. Pull back the plunger to the dose. Once you get the proper dose, you pull it out and you hold it like a dart. Keep your fingers off the end. Hold it like a dart. This medication can be injected into the thigh or the deltoid. It can go through clothing, the needle, it's pretty tough. It can go through clothing. Keep in mind this person is unconscious. That's the only time you're going to administer this medication. So I always recommend that you go for the leg, because EpiPens, people know leg, and I don't want you to be confused. But if you have presence of mind and know that this can go in the arm, you can inject it in there. Hold it like a dart, go through the skin, through the clothing if need be, then push the plunger. Once you push the plunger all the way in, you feel that resistance at the base, remove it, and put it back into the case that you got it out of. Do not recap the needle. That's when most needle sticks occurs, when you're trying to put the cap back on a needle. Put it in the case, and you're going to give this to the EMS when they arrive. Okay? Like I mentioned, these people that require the glucagon are unconscious. So chances are they're on the ground, right? If you can turn them on their side, that's the best position for them, because many times when they come to, they're going to vomit, and we don't want them to aspirate. Now I realize the bus is a very tight setting, so that might be they're in the aisle or they might be on the seat, but try to protect them as much as possible. Any questions about the glucagon? Yes, what?
Do you need to write the time on there when you gave them that?
It's not so much necessary. I mean, in the moment, I'm sure if you can recollect back to what it is, that's fine. We do need to document that back at school the next day, so if you can come in and talk to us and tell us what happened, we definitely need to know that information. Okay.
Hopefully this will work very quickly, so you'll see some results.
Yeah. Like I mentioned, in the home setting, it's not that they would have to call 911 at all times. In the home setting, if this happens, they would inject the glucagon, and then when they came to, they would eat some carbohydrate, test their blood sugar, and see what it is. But our district's policy is to call 911 and have them seek medical attention. All right, page 39. Next thing we're going to talk about is life-threatening allergies. Anaphylaxis is a life-threatening emergency for people that have allergic symptoms for perhaps a food they've ingested. Peanuts, a big culprit, as you're probably well aware of. We have strawberry allergies, nut allergies, dust allergies, bee sting allergies. Students might have EpiPens to prevent life-threatening emergencies for those medical conditions. Symptoms of anaphylaxis is mentioned on page 39 with the bulleted areas there. Can be very minimal. They can be itching, hives, but they can quickly progress to swelling of the lips, tongue, and then airway with restriction. I know students aren't supposed to eat on a bus, but that might happen. Some students are so allergic, it's not that they have to ingest the food, they just need to be in the surrounding of the food. Bee sting allergies would be a big thing on the bus, I would think, during certain times of the year. What you need to know is if you have a bus form for a student that indicates they have an allergic reaction that's severe and they have EpiPen ordered and they self-carry it, if you start seeing signs of an allergic reaction, they ask you to stop the bus or you see something that causes you to pull the bus over, remember, we have the order and you have the ability to give this medication. What studies are finding is that people will delay giving an EpiPen. It's kind of a scary thing to do, right? They'll delay it thinking, oh, it's not going to happen, it's not going to progress. What happens, it starts to progress very quickly. And even though they might be itching, it quickly can cause airway restriction, which can quickly lead to death. And if you wait to give that EpiPen, it might not work. There are cases where people have been given 2 doses of an EpiPen and it's a fatality. So don't delay. I would say especially if you see 2 body systems involved. So let's say they're itching, skin, one body system, and then their lips start to swell. Lip swelling quickly progresses to airway restriction. So don't hesitate. The bus form tells you that if you don't have that emergency medication, you follow the emergency action plan, which is, of course, to call 911. Everybody good to question 20 on the test? Okay, page 40 in the booklet gives you step-by-step instructions on how to administer the EpiPen. As with the glucagon, the first thing you want to do is have someone call 911, right? Always the first step for an emergency medication. So as I mentioned, this EpiPen, there is a Kentucky regulatory statute that says that students can self-carry and self-administer this medication. Although they have the order to self-administer it, it could be very unlikely that a student would actually follow through with that. So you might also have to step in and administer that EpiPen if they get stung by a bee or ingest peanuts on the bus. The recommended site for this administration is the thigh. That's why I said the glucagon, don't hesitate to go to the thigh. You know, that's the right spot for everything. It can go through clothing. So we're going to go through the steps. There's 2 different dispensing systems for an EpiPen. All EpiPens come in a 2-pack. Again, they're dosed by the physician based on the student's weight. So you might have an EpiPen or an EpiPen Junior. The Junior's for kids that are 55 pounds and under. They come in a 2-pack, but that doesn't mean that you're going to get both of them in the box. Oftentimes parents will remove one of the doses because you can only imagine all the different locations they have to have these EpiPens at, and they cost quite a bit even if you have insurance with copays. So parents will split up the box and just give you one EpiPen. The reason for the 2-pack is the effect of the epinephrine may only last 10 to 15 minutes. So you might see a student with symptoms, you give them the EpiPen, they seem to improve. And if the EMS doesn't get there within 10 to 15 minutes, you might start to see some regression in their response. If you have that second EpiPen, you could give it at that time. So that's why it comes in a 2-pack. It comes in a hard case in the box, and you simply just flip open that case. And then you drop the EpiPen in your hand. The trainers and the real EpiPens have directions on the side of them for quick reference. Remember again, those directions are in your red folders. Review them from time to time. So to activate this, you have to pull the blue cap off the end. Wrap your thumb around your fingers, and you stab and jab the outer thigh. You'll hear it click, and you hold it for 10 seconds. Once the 10 seconds is gone, you remove it, lightly massage the area. If you see blood, don't touch it. I don't want you to become in contact with bloodborne pathogens. The tip will stay extended to protect you from sticking yourself with that needle that stays exposed. And you'll drop it back into the case, and you'll give it to the EMS when they arrive.
You gotta hit to shut the lid, 'cause
Yeah.
it won't, is that open like that.
If you'll
Something like that.
Okay, will you reset that for me, or give me that other one? I mentioned wrap your thumb around your fingers. That's important. People have a tendency to want to do this. What happens if you got it going the wrong way? Stab and jab, you just stuck yourself in the finger. That's not the intended target. Keep your thumb around your finger, or thumb around your fingers. If you stick yourself, your thumb's going to turn white, it's going to hurt, probably going to feel your heartbeat in it, and you're probably going to be the one going to the emergency room. So keep your thumbs off the end. When the EMS arrives, you're going to give it to them to take to the emergency facility. Okay? That's one delivery system for an EpiPen. This has been out a couple years. It's called an AviQ. I feel it's the best delivery system, but because of insurance and people needing generics and things like that, you may or may not see this be the medication that's carried by your student. It comes in a 2-pack as well, but again, for various reasons, you may or may not have both of them being carried by the student. So it talks to you.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard.
There's only one red end.
Not ready to use, replace to inject. Place black end against outer thigh, then press firmly and hold in place for 5 seconds.
And there's only one black end, right? So you can't go wrong.
Inject.
Place it on your thigh, push.
Then 5, 4, 3, 2, 1. Injection complete.
Okay.
This trainer may be reused for training purposes.
The real one goes on to say this medication has now been used. See your medical provider for a refill. It's going to the emergency room with the kid. Parent will get the information then. Okay. Now there's a little bit of differences to the two. Remember, the full-size EpiPen is hold for 10 seconds. The AviQ is 5. It counts for you. As you can see, it's a little bit shorter, so it doesn't take as long for the medication to be administered. It also has a more sensitive spring-loaded mechanism, so you don't have to stab and jab. You place this on the thigh and press firmly. If you know what to do, and you have the presence of mind, you don't have to listen to it. You can go right through the cycle. Go ahead.
This trainer to inject. Place black 5, 4,
But for the counts, you have to wait.
1. Injection complete.
So, 2 different types of EpiPens. Again, that's why you're going to look at the student's medication to see what you've got to deal with if the event would arise. Okay, everybody up to question 26? Okay, page 41 in your manual. A little bit of general information about seizures. Not all seizures are what you might call convulsions. Some seizures are staring seizures, blinking seizures. It might not be very obvious that they're even having a seizure. Not all seizures cause the person to lose consciousness. And seizures can last from a few seconds to minutes. The medication, the emergency medication for seizure control is called Diastat. It's Valium in a gel. And this Diastat is ordered, again, the milligram is based on the student's size. It comes in a box, it's a 2-pack. Again, you might only see one of them. But on the outside of the box, it'll have the student's name. It'll say how many milligrams are locked in. And you can also, when you get your trainers, see that there's a little window on the side and it has the amount of milligrams that are locked in that should correspond to what the outside of the box says. But the outside of the box will tell you when you're supposed to administer this Diastat. In most instances, it is to be administered after a seizure has lasted 5 minutes. But we do have some students in our district that their seizure history tells us that we don't need to wait for this medication to be administered because we know their seizure is going to last 5 minutes. We're not going to wait. We're going to give it immediately upon the onset of the seizure, or we're going to give it 1 minute after the seizure has started. So it's important you know what the time frame is that's designated when you're going to give this medication. And it's going to be on the outside of the box. So as I mentioned, there's various different types of seizures. I'll never forget when I was at Kitten Elementary, I had a bus driver call the next day. She had a student on our bus route that had a seizure. She didn't know it because it must have been a staring seizure, but the student sitting in the seat next to her could recognize that this little girl was not responding to their questions and wasn't communicating. So this other student went up to the bus driver and said, "Hey, I think something's wrong with my friend back here." The bus driver pulled over. The little girl was coming out of her staring type of seizure and started crying and then vomited. So it might not be something that you're aware of. So first thing you want to do if you know that it is an obvious seizure is to time it, because you need to know when the time frame approaches that you have to give this medication. The second thing is you want to keep that student safe. And I realize the compromising situation of a bus, but a safe place for them again is lying on the ground, because 99% of the time when they come to, they're going to vomit. Also, a large percentage of the time when someone has a seizure, they will be incontinent of their bowel and bladder. They won't be able to control it. So it's a very, very embarrassing thing for the students to have a seizure in front of their friends, and it's a very scary thing for other students to see a seizure occur. So you just have to do your best. Got the bus pulled over. Hopefully you can move the students to the back or the front of the bus as far away from that student that's having that seizure activity as possible. And you just try to keep the student having a seizure safe. Try to prevent them from maybe hitting their arms or their legs if they're having a grand mal seizure where there's a lot of movement. Protect their head. You don't try to restrain them. You don't put anything in their mouth. Loosen any tight constricting clothing that might be around their neck. and you wait. And if it's 5 minutes, it's going to seem like an eternity. But we do not call 911 until we administer this medication. Okay. Students that have seizures on a regular basis, if we called 911 every time they had a seizure, that's a lot of hospital visits, that's a lot of co-pays, that's a lot of money to a family that knows that they have a student with seizure disorders. Of all the medications, the emergency medications that we've gone over, I would say this is the medication that we give most of in the school district. Not that we do it that frequently, but we have given this on a couple occasions, and it's a great many of the times it's in our special need population. Those are going to be the kids that carry their Diastat on the bus, in their backpack, on their wheelchair. So that brings a whole nother set of problems. If you have a seizure on a student that's in a wheelchair, really think through your plan in place and how you're going to talk to your monitor. You guys put a plan in place so that when it happens, you know what to do. And run through that plan once a month so that you're prepared. Can everybody answer up to question 35 with what I just talked about? Okay, take a minute. As I mentioned, a seizure is not always an emergency. But there are times that it is. We already mentioned if it lasts more than 5 minutes. Students can have repetitive seizures where they seem to stop their seizure activity for a few seconds and they have another one. That's an emergency situation. People that are diabetics, that have extremely low blood sugar, a seizure might be their signal, similar to their unconsciousness. So if you have a diabetic student that has a seizure, give them their glucagon. Call 911. If you have a student have a seizure on your bus and it's the first time they've ever had a seizure, you have no information that the student has a seizure disorder, a first-time seizure is an emergency. If a seizure happens in water, so like at Scott High School where we have a pool, if a seizure happens in the water there, we're going to call 911 because they might aspirate water. It's not uncommon for people during a seizure episode to be light blue around their lips, circumoral cyanosis. That's not uncommon if it's a dusky blue, but if they seem to really have difficulty breathing and you see marked blueness, definitely call 911. Okay, so page 42, 43, step-by-step directions on Diastat. So we mentioned it's a 2-pack. Yeah, it's fine. Inside the package is 2 packets of lubricating gel. We're going to lubricate the tip before you insert this into the rectum. The packets do not have gloves in them, but any Diastat that comes through Health Services Department, we put gloves in it for you. But again, if you have a student with Diastat that self-carries, look at the equipment. Make sure there's gloves in it. You do not want to administer this without gloves. The Diastat should have a green ready band. If that green ready band is not visible, don't give it. So this contains 40 milligrams of medication. The physician is going to order the amount of milligrams based on the weight of the student. The pharmacist will dial in the medication, as I mentioned before. You'll see that number on the outside, and it'll lock in. So depending on the size of the student and the dose, that plunger might be out just a very small amount. Let's say this is a small preschool student. Doesn't need a lot. If it's a larger student, the plunger might be out quite a bit. You're not going to worry where the plunger's at. It's where it needs to be for the dose that you need to administer. So we mentioned that you're going to look at the outside to see what the time frame is that you need to administer this. Student has a seizure, you're going to keep them safe and you're going to start timing it. That doesn't mean that you can't have your monitor go ahead and notify the bus garage that you've got a medical situation. But we're not going to call 911 until we go to administer this. So you've got time to try to get the other students to the back of the bus. What we find is that the older the students are, the less likely they're going to self-carry this medication. It's a parent's decision, but especially on a bus with the close quarters and the need to expose the student to administer this, parents sometimes seem to be hesitant to have this as a self-carry for their students. So you can get your medication together so that when that 5 minutes starts to approach, let's say 4.5 minutes, you can go ahead and put on your gloves. You can pop off the cap and you just put your thumb underneath it and this cap will pop up. There is a plastic stylus that should stay in the tip when you take off this cap. Make sure it's in there. You don't want it to stay in the applicator. You can go ahead and lubricate the tip. And then at that 5-minute mark, you're going to administer this medication. That's when you're going to have someone call 911. You, of course, have to have the students' clothing removed. Have them on their side. If you can bend that upper leg, and if they can be facing you, that is the optimal position. That way, if they're moving, they're going to move towards you, and you can keep them in your control. Again, I know you're going to be on a bus, and we can't go through all the situations and scenarios, but do the best you can. Bend that top leg. It'll expose their rectum. This tip is lubricated. You're going to insert it in the rectum, and you're going to press the plunger slowly for a count of 3. Now, it might take you longer if you're giving a full dose, but don't push it any faster than a count of 3. Once you've met that resistance of pushing the plunger all the way in, you're going to hold it there for a count of 3, and then you're going to remove it, and you're going to try to pinch their butt cheeks so they retain the medication for another count of 3. So 3 counts of 3. As I mentioned, this is Valium. Mucous membrane is very permeable to medication. That's why you put nitroglycerin under your tongue. Mucous membranes in your mouth. A lot of mucous membrane in the rectal area, so that's the best absorption we can do for medication. Put it back. If you have gloves on, you can peel the gloves over top of the diastat as you're holding it in your hands, and then you give it to the EMS when they arrive. Cover the student back up to try to keep, protect their privacy, and wait for them. Give the drug to the EMS when they arrive. Okay, so is everybody able to answer all the questions? Just so you know, on the district's webpage, this manual that you've been looking at as we've gone along is available on the Health Services webpage of the school district's webpage. And also the video will be there for you to reference as well. So if everybody will put their name on the top right corner of the first page of their test booklet. You're going to hold on. I'm sorry, not test book. Yeah, test booklet, not manual. Remember, you're not writing in that manual. The test, stapled test booklet. Put your name in the top right corner. When you go to your session to do the return demonstration, you're going to take your test and your manual, and it's going to be collected at that time. So please, do not turn anything in until you go into your return demo classroom. We're going to take a minute to run through and check your test. So it'll be graded when you turn it in. So, when I rearranged these test questions, it caused some consecutive answers to occur, which means 1 through 9 is A. If you've missed one of those questions, please put an X on the number. 1 through 9 is A. 10 is D, as in dog. 11, D. 12, 13, 14, 15, A. 16, B. 17, A. 19, D. Wait a minute, skipped one. 18, D. 18, D. You guys good? 18D. 19C. 20D. 21 and 22 are both A. 23C. 24B. 25A. 26B. 27, 28 are also B. 29, 30, 31 are A. 32 is A, 33B, 34A, 35G. Remember, you can miss 5. Underneath your name, if you'll put the number that you missed, or -0. Underneath the amount you missed, here is your percentage. Please write this as well. If you missed 1, it's a 97, 2 a 94, 3 a 91, 4 an 89, 5 is an 86, and if you missed C, see me afterwards, because we've got problems. Okay. So as I mentioned, everyone's going to take your manual and your test booklet to your session for the return demonstration. Sherry's going to come up and tell you how we're going to handle the return demos.